Hello everyone, this is Dr. Ashwini. I'm a functional medicine practitioner. So today we will talk about IBS, Irritable Bowel Syndrome. Approximately 12 to 15% of the population across the globe suffers from this condition. That's a very irritating problem for us. If we don't have healthy gut, we don't have a healthy mood. 40% of the population, this might be a very mild problem. Approximately 35% of the people might have a moderate problem, and in 25% of the people might have a severe form of IBS. All right. So conventionally, we are told, all right, eat more fiber. Sometimes what happens if we take more fiber, we get more bloated. Conventionally, we are told that we have to live with the problem. Now, how can we live with such a problem? Right now, sometimes we are told that if we have diarrhea, we take antidiarrheal medications. If we have constipation, we take some laxatives. It's okay to symptomatically solve the problem, but we really need to find what is the cause of the problem. Now, sometimes it also happens, right? If abdominal pain is too much and a patient cannot tolerate, they are put on to antidepressants, SSRIs, right? So it is again okay to use symptomatic treatment, but it is also important to find the cause of the problem and give the right solution. Now let us talk about some of the symptoms. Sometimes people have diarrhea and constipation, or sometimes it keep alternating. Bloating is another problem. You eat your food, your stomach get bloated, right? Sometimes acid reflux is another problem. Poor mood, people start moving into depression because of IBS. This is because of the gut brain axis. If our gut is not healthy, it impacts our brain in a large way. People get fatigued, people get tired, lethargy, sometimes they don't have right nails or hairs, right? These are some of the common symptoms of IBS. Let us understand what are the causes. It's important to know the cause of the problem before we can find any solution to the problem, right? If we're not eating our food by chewing it thoroughly, that can also be one of the triggering factor for IBS. If we're not eating mindful, we are sitting in front of a TV, we are sitting in front of a laptop and popping things into our mouth, it can cause irritation because we don't digest our food. We don't release enough digestive enzymes to digest the food. When that happens, it irritates us. When it irritates, this is where IBS, right? Next part of the problem is if the stomach acid is low. Often we are told that our high stomach acid is the problem. Fact of the matter, it's low stomach acid. When we don't have enough hydrochloric acid into our stomach, we don't digest our food. When we don't digest our food, this is where it irritates the gut. Third, if we have a bile insufficiency or pancreatic enzyme insufficiency, that can also be one of the triggering factor for IBS. Next is the leaky gut. Leaky gut means there's an increased permeability of the intestines. That means we are supposed to only get nutrition from the intestine, from the gut to the bloodstream. When we start getting absorption of toxins or undigested foods or some lipopolysaccharides, bacterial byproducts in the stomach start getting into the bacterial bloodstream, it triggers an inflammatory response, causes us inflammation. That also can be one of the reasons for IBS. All right. Next reason is dysbiosis. Dysbiosis means when we don't have the right bacterial balance. It's an overgrowth of unwanted bacteria, fungus, or parasites in the stomach, in the gut, especially the large intestine. This can also give us this nasty condition called IBS. Now, before we solve the problem, if we know in specific what is the cause of our problem, is it it's a low acid, or it's a dysbiosis, it's a lack of digestive enzymes, or the stress. If we know the problem, we can solve it in a right way. Now, let us talk about some of the solutions for the problem. I mean, first, if we know the cause, we can find the solution. In case if you're not eating the right way, you're not doing a right mastication, not chewing the food completely, please start doing it. If you get gastric reflux, your food is getting into your esophagus or the mouth, or you taste your food even next day, that means your stomach is low on acid. Make sure that you help your system to get enough acid. How can you do that? By taking a apple cider vinegar after your meals or before meals, or maybe a ginger tea, or maybe bitter herbs, or maybe if required, then you can move to a betaine HCl, a supplement which can help you to enhance your stomach acid. Of course, do this under guidance of a experienced practitioner, right? Now, if you have leaky gut or increased permeability because of multiple factors, right, make sure that you work on that, especially when there's a hole in the gut which are not required, which is triggering inflammatory response. You need to lower down the inflammation. Make sure that you don't eat certain foods like wheat and dairy, known triggers of leaky gut. Wean them off till you heal yourself. And of course, if there's a amino acid called glutamine that you can get from a cabbage juice or maybe in a supplement form, so that the heals in your gut are healed and they're not causing a inflammatory reaction, so that your system is at ease. If any candida infection, your white coating of the tongue, make sure that you get onto certain herbs so that that coating is, you are able to get rid of that fungal infection and you get yourself relieved from the IBS. Now, next is use of the nutraceuticals. Certain minerals and vitamins like zinc, vitamin A, vitamin D, omega-3, they can help you heal your gut. Now, certain herbs can kill the bad microbes, can kill the bad fungi, can kill the parasites. Make sure that under guidance of an expert you take those things, so that you solve the problem in a sustainable way instead of just going for a symptomatic relief. We have covered pretty much what are the symptoms, what is the conventional thought process, and what is the functional medicine approach, wherein we look at the cause of the problem specifically and find a solution to it. Now, if you have more queries, more doubts about it, please do write to us in the comment box so that we can make another video to answer your queries. Thank you so much.